You have pioneered something called the combination approach to anti-aging. Can you discuss for us what is that approach? How is it different from what's being done?
Well, I've been in practice now for almost 10 years, and what people want is basically a non-surgical approach to anti-aging. So they want to look fresh, they don't want to look tired, they want their skin to be glowing, remove sun damage, and really address the signs of aging. But people don't want to look unnatural, they don't want to go under the knife. And with the new technologies that are available now, and the combination of those, we call it the time machine by Dr. Tess. We really can turn back the clock on aging, address all of the signs of aging, and make people look natural, look fresh without undergoing surgery.
So who's an ideal candidate for this approach, age-wise, maybe temperament-wise as well?
Well, I think that, I would say the majority of people, when they find out that there are non-surgical options, they will opt for those. And these are probably women in their early mid 40s and older who are starting to see, gosh, everyone's commenting how tired they look. They're starting to notice that their skin's sagging. It just doesn't look the same. They're not liking how they look in their photos. They're just like, it's not the same. And so they're coming to me and we're educating them that there are these 3Ds of aging. There's deterioration of the skin, and that's the blotchiness, discoloration, large pores. There's deflation. We lose volume in around the mouth, around the eyes, and then there's descent. So gravity, pulls down on the skin. You start sagging, and all of those things can be addressed non-surgically now. And so what I do in my practice is look at a patient. We customize their time machine program depending on their skin type. There are certain devices and technologies that are good for Caucasian skin, and then those that are good for non-Caucasian skin, depending on the amount of downtime, depending if they want a 5-year time machine or a 10, 20-year time machine, depending on their budget and depending on what we need to address. There's some people who need more sun damage correction, some people need more revolumization, but overall the result ends up being natural. The reason why I call it the time machine is patients will just look how they look years back. It's still going to look like them, and I think preserving the authenticity is so important to people that this time machine by doctors is our most popular treatment.